This is a time dedicated to raising awareness for bladder conditions and creating support for those affected by these issues.
And Dr. Helfer from Christie Clinic is here for our morning round segment to talk about the importance of staying on top of our bladder health. Good morning, sir.
Good morning.
Sure. So, Bladder Health Month. Maybe a lot of people didn't know that about November. Let's talk about why this is so important.
Well, Bladder Health Month, not only does bladder health affect men and women, but it specifically affects men 50 years of age and older. And as a urologist, we do a lot with the prostate, and the prostate affects the bladder, the function of the bladder health, which can then lead to health of the kidneys also.
So why should we care about prostate health?
Prostate health is very important, and prostate disease is very common in American men. 1 in 3 American men over the age of 50 will experience some type of prostate issues.
Wow.
1 in 6 American men will be diagnosed with prostate cancer. So obviously that's what I do as a urologist, is we deal with a lot of prostate health in men.
Right. So what are some of the symptoms that there might be something wrong?
So one of the more common things that men come in to see urologists for is BPH, which means enlarged prostate. And those men come in with urgency, frequency to go to the bathroom, slowing of the urinary stream, getting up a couple times at night, feeling like they incompletely empty their bladder. Other symptoms such as double voiding, where they start to urinate and then they start, stop. And these symptoms generally get to be quite annoying to patients. It can affect their sleep patterns at night, and overall their general health.
Yeah.
So when is it time to see a doctor?
When you start to have symptoms that are bothersome enough, you should come see us. I tell patients this isn't a life-threatening issue like cardiovascular disease or a stroke, but it does affect quality of life. So when it gets to that point, you should definitely see your physician.
Is there any point where men should start getting, either preventative or just pre-screening things? Like they tell people when they get older, you should get a colonoscopy. Is this one of those things that men could have checked out before it becomes an issue?
Well, men should have their PSA checked starting at about the age of 50. If you have a family history of prostate cancer, we do recommend that it gets checked sooner. PSA is a blood test to screen for prostate cancer. Now, there's no correlation between PSA and BPH, enlarged prostate symptoms. So once again, it comes down to quality of life. When the patients start to notice that their urinary symptoms change, then it's time to get evaluated.
And if we can, for a minute, let's talk about the UroLift. What is that, and how will that help people?
So the UroLift system is a procedure we do in the office. Many men who have BPH, they actually start off on medication to help with their urinary symptoms. Over time, the medication may not work as well as it used to. Patients want to get off the medication, or they don't like the side effects. And then we offer minimally invasive procedures in the office. It's about a 5-minute procedure where we actually put implants into the prostate based on the name UroLift, where we actually lift the inside of the prostate open so that men urinate better. It takes about 5 minutes. You can plan on spending about an hour in the office from the time you walk into the door to the time you walk out. Wow. Patients can get back to relatively normal activity within a couple days to a week.
Sure. So where should people go for more information about this?
Go to the Christie Clinic website, or you can call our office.
Very good.
Dr. Helfer, thanks so much for your time today.
You're welcome.
I'll be right back.